Today I want to talk to you about our newest FDA approval, Juvederm Voluma for the temple. It was just recently FDA approved a couple weeks ago. I want to talk to you about why it's so important for our industry that we have this new on-label indication. Restylane was first FDA approved back in 2003. And what was so important about that is it was our first FDA approved hyaluronic acid filler. Its indication was for the smile lines or the nasolabial folds. Before that, we had collagens. I remember injecting Cosmoplast and Zyplast. The issues with those is they really didn't last very long. Back when fillers were first FDA approved, we were not spending enough time addressing the whole face volume loss. We were very focused on the nasolabial folds and some cheeks and lips, but those were very specific areas. Back then, there wasn't a lot of talk on pan-facial rejuvenation. That's something that has grown in more recent years. With more and more indications, like Juvederm Voluma for the temple, we have more research supporting pan-facial rejuvenation and its safety and how to address the patient in terms of facial-related volume loss to support an overall natural, rejuvenated look. The research behind these FDA approvals help us in terms of supporting us in the technique that we use and how much product we use and the safety in those treatments. I have a funny little story. Well, not so funny, but I'll tell you about it. Years ago, a patient came to me because her chin bothered her. She had a smaller chin with dimpling and she wasn't happy with how her chin looked. She didn't want Botox or any other neuromodulator. She only wanted a filler to correct that look. I let her know that we could soften it with a dermal filler and that this was an off-label indication, meaning it wasn't FDA approved, but it was something that we commonly did. She agreed to the treatment and I went ahead and treated her. A couple weeks later, she came back, and even though she saw improvement, she told me she did some online research and talked to me about how she learned that it was unsafe to perform treatments in off-label areas. I explained to her that this was standard of practice and very common, and it takes a long time to get FDA approval, and that the treatment that I did for her was very safe, and I've done hundreds of them with great patient outcomes. She still had a level of distress, and even though she had a good outcome, she felt very uncomfortable after what she read online. At that time, I would have loved an on-label indication to support the fact that the treatment I did for her was the best possible treatment within the realm of what she allowed me to do. Allergan Aesthetics owns Juvederm Voluma, and on that note, they have on-label indications for over 90% of the face. This means that providers get to be trained in all these on-label areas to better address patients' needs. Our industry is growing and we have more support and more research than ever to help patients have best possible outcomes. To note, the technique used in the study for Juvederm Voluma in the temple was the supraperiosteal technique, 1 up, 1 over. The sites identified by moving 1 centimeter superior lateral and then inferior over from the temporal fusion line. After inspection and palpating the injection site's adjusted so it's the safest area for the patient. This way we avoid any blood vessels like the superficial temporal artery. The needle is injected at a 90-degree angle and filler is injected until the skin looks filled appropriately. This is 1 injection site unless the injector notices that there needs to be more product in a different area. Then the study allowed up to 2 other injection sites. So there would be a total of a maximum of 3 injection sites. The injection technique included just 1 single, slow, gentle injection. And like I mentioned, there could be up to 2 other injection sites if necessary. Patients are to avoid applying any makeup for 12 hours after the treatment and avoid any strenuous exercise for 24 hours after treatment. There were 113 participants in this study, with 40 patients receiving a touch-up during the course of the study. The total product used, including a touch-up, was a total of between 1.1 ml and 6 ml with a medium of 3.81 ml. The clinical study found that patients rated themselves on an average of 5 years younger 6 months out. In addition, 1 year after treatment, 85% of participants were satisfied with the treatment and would recommend it to a friend. There's a lot of talk about this supraperiosteal injection technique and the fact that it is possible to have an artery on bone. That's why me personally, I like to have an ultrasound, and I find it more and more common that offices are utilizing ultrasound for some of these treatment areas. However, another injection technique is to use a cannula. Some people like to go into the second plane with a cannula and inject filler there. And there is possibility that the product may not lie as even in that area, so you have to be very careful. And some people like to go under the 4th layer into the 5th layer where they can lay filler there. The drawback is that there is a possibility you can go through a blood vessel and cause a big hematoma. Also, you're getting kind of deep in there and you may slip out and find yourself in a different plane. So you need to be careful with that as well. I think any of these injection techniques aren't foolproof. There are different safety measures to help address each of those areas. There are risks with each of these techniques. However, with this new FDA approved indication, we're also going to have more reporting of adverse events in this area, which means we're going to get more research in terms of when we're having adverse events and what injection technique was used in that area. We'll learn more and we can alter our injection techniques from there. New FDA indications help support us in our practice. They make patients feel comfortable. I look forward to seeing more and more FDA approved indications in the months and years to come. Our industry is only going to grow from here. If you like this video, please like and subscribe. Leave a comment in the notes to let me know what else you'd like to hear from me. Thanks.